Thanks, Amber. Thank you all for joining us this afternoon, and thanks to the National Council of Juvenile and Family Court Judges for hosting this event. And I am happy to spending time with you in lockdown. I'm on from the East Coast of the U.S., Connecticut, where we've been locked down for about a month, and I hope everybody is staying safe, as their loved ones are safe, and that you're weathering this period well, physically and emotionally in terms of health. And so just sending out just concern for everybody as we kind of go through these unusual times. I'm really pleased and proud to be doing this webinar as part of a series of webinars that are connected to a special 20th anniversary journal that came out related to the Greenbook, as it's known, and I'm appreciative of all the folks who are involved with creating the Greenbook project and the Greenbook itself at the beginning, and kind of moving those forward, moving those concepts forward through trainings, through collaborations, through the demonstration projects, and then beyond. And just a shout out to Jeff Edelson, who's on here, who was one of the primary authors of the Greenbook at the beginning. And it is formally known, it was called Effective Intervention in Domestic Violence and Child Maltreatment Cases, Guidelines for Policy and Practice. And so this webinar is meant to summarize and engage people on a paper that was included in that 20th anniversary journal, and the title that is Building on the Greenbook, a Perpetrator Pattern-Based Approach to Improve Child Welfare's Response to Domestic Violence. And I wrote it with somebody who works with me, Claire Wright, and this will give you a view into some of the thinking that's gone into the Safe and Together model over the last 15 or 20 years. It will kind of take us back to some of the core issues that really drove the development of the Greenbook that are still operative and important, and really talk about how we continue to extend that work 20 years later and beyond. And I'll talk about my current role. I'm the executive director of the Safe and Together Institute, the founder of it, and also the developer of the Safe and Together model. And my involvement with the Greenbook came after it was developed and written, and I was invited in to provide technical assistance to some of the Greenbook demonstration sites, and really was very lucky to have a chance to work closely with some of the creators of the Greenbook, with some of the sites, and really to share learning together and be part of a really exciting project that has had ripple effects far beyond the actual document itself and the actually federally funded projects. I know that there were multiple places that I worked with years later, even 10 years later, maybe longer, where they had set up committees, collaborative committees, to go for the funding for the Greenbook demonstration project. And 10 years later, even after they didn't get the funding, those committees were still meeting and still trying to shape the practice in their area, the cross-systems collaboration. And to me, that really speaks to the power of the concepts that really were embedded in the Greenbook, and also the desire that is out there and still out there to fix some of the issues around collaboration that still need to be fixed. And one of the large framing perspectives that I'm going to offer is that that today in our work at the Safe Together Institute, our clients are actually the system. You know, we're about systems change, and we really target a lot of work to child welfare. We involve the courts. We support domestic violence advocates. We work with batterer intervention programs, with guardians ad litem, really anybody who might touch a family involved with the child welfare system. And the goal is to make those systems better partners, better supporters of adult and child domestic violence survivors. That's the backdrop, and that's our desire. And so today's presentation, which really is based on the article, is really designed to kind of meet these needs and kind of forward this agenda. And so the webinar objectives for today is really to discuss how the Greenbook has shaped the environment related to perpetrator accountability in child welfare. And I'm going to make some distinctions and talk about perpetrator accountability as it's been, perpetrator accountability directed to perpetrators as parents, what the difference between using a perpetrator pattern-based approach and perpetrator engagement strategies are. We're going to talk about how an underlying shift in the work with fathers can advance domestic violence-informed practice. And I would think this is one of the main things that I want to communicate to people today, is that one of the biggest barriers to doing good domestic violence-informed work that really holds perpetrators accountable as parents, intervenes with them to change the situation better for adult and child survivors, that leads to better partnership with survivors and their kids. One of the biggest barriers is the fact that there is really limited skills and knowledge and training in our child serving systems around working with men as parents in general, which creates a huge barrier to working with domestic violence perpetrators who are parents who are male, which is the vast majority of what we're talking about. And so I'm going to talk about how we need to really tackle this head on to really get better at partnering with survivors. And the last thing I'll do is talk about the Safe and Together model and how this perpetrator pattern-based approach, which is exemplified in the model, can advance the vision of the Greenbook and its ideas and concepts. So while I'm right here, there's another poll that I'm going to ask you to do, so I can kind of tailor my presentation to your knowledge base, which is put something in about how familiar you are with the Safe and Together model. And this will just be, we'll have this up for about 30 seconds. And remember, if you have, I've already posted my email in the chat box. If you have questions throughout the presentation, I'll be stopping every 20 minutes or so and just reviewing questions. And so this will really help me kind of understand the audience. And clearly what's coming through is that there are a lot of people who are not familiar with Safe and Together model, which is great because you get a little bit of exposure to the ideas behind it and what the thinking is and how it's being implemented globally. So give this another 10 or 15 seconds, and then everybody can see that we've got some people who know it a little bit and a few more who know it somewhat or a lot. So just take another minute to kind of finish that. I mean, another few seconds to finish that. All right. Well, we'll stop here, Amber. Thanks. And we can close the poll and just clearly over half the folks are not familiar with the model. So you'll get some introduction to it. I've already put our website and our virtual academy site in the chat box. If you scroll up, you can see that. So you're welcome to check that out and see, what information is available there. So just to orient you, like I said at the top of the call, I'm the executive director of the Safe and Together Institute. We've been around in our current form for about 15 years or so. My personal roots go back about 30 years in the violence against women movement. And our mission is, excuse me, is to create, nurture, and sustain a global network of domestic violence-informed child welfare professionals, communities, and systems. And that's child welfare defined really broadly. So anybody who touches a family where they might have child protection issues kind of involved with the system, or even working with child and family agencies. So child welfare really broadly defined which means statutory and non-statutory work as well. And so you'll see that much of our work is really targeted to work with families where there are children involved, and that's kind of the main framework, though our work is applicable across families with and without children. And what I'm going to say is that really, our mission is really to transform the framework of practice. And I hope that'll become clear as what we're talking about, to talk about this, which is, we're not going to be focused on a new service to deliver or a new model for doing direct intervention. This is about how we talk to one another, how we talk about cases, because in many ways, accountability for perpetrators, particularly as parents, starts with the language we use in our conversations with one another, and the way we talk to families, and the way we write down what we think is going on in the home. And I really want to, again, I'm going to keep coming back to language and a shared framework, because one of the things that we want to do is create that shared framework so we improve collaboration and we improve outcomes for families. And you'll see that this diagram really gives you a feel for sort of what our goal is. And we want better outcomes for families, safety, well-being, and permanency. And that obviously mirrors the things that are critical in the U.S. context in terms of child protection, child welfare actions and involvement with families. And we have a set of models and principles and critical components and tools, and I'll talk about some of that. But the goal really is skill-based changes in practice. So I want you to think about, as you go through this webinar, about the skills involved: interviewing, case planning, documentation, assessment, and how they manifest in filing a neglect petition, or how they get kind of put into practice in supervisory practice, and how they shape conversations, cross-systems conversations. And I want you to think about the world you inhabit, the job you do every day. And I want you to think about, so where's my practice in this area? How does this show up? And so when we, for instance, talk about applying a perpetrator pattern-based approach, do your notes reflect the specifics of the perpetrator's pattern of behavior and the actions they've taken to harm the kids, or do you speak in generalities about a history of violence? And so we're really about landing this knowledge, the skills, and day-to-day practice for advocates, for child protection workers, for court systems, for guardians, for CASAs, all the folks who might be involved, supervised visitation centers I've seen on the call as well, that all these, we've worked in all these environments, and the Safe and Together model has been used in all these contexts. And so for me, I want the systems to be better collaborators with one another and lead to better outcomes for children and families. The name Safe and Together, so as you're looking at this image of where we've been working in the last few years, you can see that we're a global model, and we work with a lot of jurisdictions that are really kind of across the U.S. at the state level, province level in Canada, local authorities in the United Kingdom, Ministry of Defense, and then with lots of different projects in Australia. And the name Safe and Together comes from this idea that children are best served from the point of view of safety and the point of view of healing from trauma, and from the point of view of stability and nurturance, when we work to keep them safe and together with that non-offending parent, with that domestic violence survivor. And this is what the research shows us. This is what the clinical practice shows us. So it's from a child-centered point of view that we're trying to define the needs of children and see the connections that are tied to how we work and partner with that adult survivor around the needs of the kids. And that it's reasonable for systems to approach these families with the idea that we're trying to keep them safe and together with that non-offending parent, with that domestic violence survivor. And as John Myers, a colleague of mine, is on the call, and she put in the chat box, this is not only valuable for child protection environments, but it's very useful in family courts and custody-related issues. And we're seeing it applied in many of those contexts. For instance, we've had a project that we've been doing in Michigan where we've been training evaluators to apply the model in their evaluation of custody and access issues and parenting time. And that's a project that got started a couple of years ago. We have applied it in situations where there's mental health and substance issues, and the model I'll talk about in a minute really kind of covers a lot about intersections with mental health and substance use, and also intersectionality issues around race and class and gender and sexual orientation. So that as you're thinking about this, really think about the use of this geographically broad and also in terms of disciplines. It has applications across family court, child protection, all those different areas. Not going to dwell on this, but I want to give people a feel for this, that there's a wide range when people think about how the model is implemented. It's through a lot of different tools, including a lot more virtual courses right now. And our newest thing that just actually got released today, to be honest, is a free downloadable Family and Friends Ally Guide. And I'm sharing this with you so you can have a sense of how the model manifests in different ways. So the Family and Friends Ally Guide gives information to someone who's worried a loved one is being abused and helps them apply the concepts of the model in their attempts to assist survivors, because we know that family and friends are often the first people that are disclosed to, but often the response is less than what we'd all hope from those loved ones. So this will be go to our website in the next couple of days. It'll be up there. It's on social media already. But we're really excited about this resource, and it's free and it's downloadable. So again, just to give you, I'm just going to go through these really quickly, just to give you a sense of the scope of the model's impact. Last year we trained over, this is actually a very conservative number, over 2,000 professionals through our certification program. You know, we're talking about the tens of thousands of e-courses delivered, over hundreds of training days delivered across the globe, and that we expect that we're impacting conservatively around over 44,000 kids, you know, depending on how you kind of figure caseloads and family configuration. So I wanted to give you that feel. And the model is targeting these groups of people in the last year. So you're going to see yourself in here. If you're not in here, you're probably capturing the group of others. But I want to give you a sense of how many people reach. And I think a lot of times people are surprised how much this model is adopted by child protection because they feel like it meets their needs. And I think a lot of times we get surprised from domestic violence advocates about that. So as I'm going through the thinking behind this approach and the connection to the Greenbook, I just wanted to have this context, and feel free to follow up with more questions. All right, so that was a little bit of a very brief orientation to the Safe and Together model and to who we are, and just understanding the reach of this. Because I'm really proud of the network of 67 partner agencies and over 150 certified trainers who are delivering the model in the U.S. and the United Kingdom and Canada and Australia and New Zealand soon. So to me, I think this really speaks to the need, the desire, the portability of this work. So if you're wondering if it's going to work in tribal areas of the United States, it's been working with Aboriginal folks in Australia, and it really resonates across a lot of different contexts. Okay. So just to move into the next portion of this, the Greenbook came together through the efforts of a lot of people, some I knew and some I didn't know, who really met and worked so hard, and for some of you, these conversations are second nature. Now they're part of what you expect, but at that point in the late 90s, there really hadn't been anything like this that I'm aware of in the U.S. and for sure abroad. And people came together and met and talked and tried to come up with guidance and direction for people about how to better serve families who are being impacted by domestic violence perpetrators' behaviors. And one of the problems that they were trying to fix, and that it's a problem, unfortunately, that still persists today, so the relevance of this is still really high, was that we had moved from a world where child protection agencies had really ignored, in many ways, so modern child protection had really ignored domestic violence as an issue. And what that means is they were often told that it was adult to an adult problem, and it was something that really workers in child protection weren't expected to address at one point, which again is pretty hard to imagine now. And what happened is, based on the work of domestic violence advocates, family violence researchers, violence against women advocates, that what we learned through all that work is that one is that domestic violence perpetrators are behaviors and choices are really harming children. They're one of the most common correlates with problems and symptoms and issues for kids, on par with direct child abuse and neglect in many ways. And subsequently, over the last 20 years, we've learned that domestic violence is correlated heavily with critical incidences, child fatality is included in that, and that it's the top 3 issues that often are facing child protection systems, which is true across the world, by the way. You know, any place we go and work, they even have terms. We even have terms for this kind of presence of domestic violence, substance use, and mental health issues. And so, you know, one place will be called the toxic trio, another place will be called the triple play, another place is, you know, with horse racing in Victoria, Australia, where it's common, they'll call it the trifecta. And none of that's meant to minimize the seriousness of that. It's really communicating that for a lot of people in the systems, they're aware that domestic violence is one of the most common issues facing that caseload. And it often comes in through the doorway, by the way, as something else: educational neglect, medical neglect, substance abuse, mental health issues. In fact, one of the hallmarks of a system that is getting domestic violence informed is its ability to take those cases and look like something else and get to the underlying domestic violence issues underneath them when that's what is there and present. And that's true for family court, that's true for child protection, you know, cases that are presenting in family court as parental alienation. Many of them are really actually the protective efforts of domestic violence survivors being misidentified, and the behaviors of domestic violence perpetrators being misidentified and not taken seriously. And so when we look at this issue, you know, what drove the work of the Greenbook 20 plus years ago is still true right now, because what we saw happen was child protection became aware that domestic violence was an important and legitimate issue for those systems to be addressing, which there's no question about that. A recent, you know, needs assessment in Ohio, you know, looked at case constellations, and they found that domestic violence, substance use, and mental health issues were the top 3 issues. And in fact, domestic violence, when they put together common case constellations, domestic violence was the most common feature in those case constellations. So when you think about the need is extremely high. At the same time, what a lot of our systems are, how they're approaching this is in terms of what is either referred to as a failure to protect paradigm. We also refer to it as a domestic violence destructive paradigm. And the failure to protect paradigm basically says that that it's the survivor's choices and behaviors that are creating the risk and harm associated with domestic violence for kids. And you may have picked up already in the language that I'm using as I'm speaking is I have rarely said how domestic violence is impacting the kids, but you're going to hear me say over and over again how domestic violence perpetrators' behaviors and actions create harm for children. And one of the most important ways that we can move away, one of the most important practices we can engage in to move away from failure to protect practice, which not only is unfair, but really, when we're talking from an efficiency and effectiveness point of view, failure to protect actually interferes with our capacity to actually work and keep kids safe. And I'm happy to answer those questions directly if people have them. And Anita, I'll get to your question in a minute. But when we talk about, the efficiency and effectiveness of child welfare systems, one of the things I want people to walk away with is systems that actually don't approach this through a perpetrator pattern-based lens often are making their work harder for their staff, maybe making unnecessary decisions to remove kids, and maybe creating risk where they don't need to. So what are the hallmarks of a failure to protect paradigm? Here are some statements that you often hear when people are coming from this approach. Why does she keep picking him over the children? She doesn't understand the impact of domestic violence on the children. We need to take the children from her because she's going to keep picking abusive men and continue to put the children in danger. She's going to keep going back to him, so that's why we need to take the kids. And so what you're going to see that all of these things have in common, and I want you to think about recent case conversations that you've had, is that it poses that the survivor's decision-making is the source of the problem for the kids. And in essence, if only she makes better choices, then the kids will automatically be safer. And what I want you to see in this framework, that the perpetrator's behaviors, their responsibility, the narrative around how those behaviors are impacting the children, what's the harm to the children, is frequently invisible. And this is why that invisibility of the perpetrator's behavior as parents is part of the reason why we end up making decisions that might not be in the best interest of the family and even in the best interest of the system when you stop and think about it. So we're trying to move away, just like the Greenbook was, we're trying to move away from this failure to protect paradigm and move towards what we refer to as a more domestic violence-informed paradigm that really is focused more on perpetrator pattern-based thinking. And so when we look at this and we listen to this and when you think about this, we're going to be asking you to think about how do you shift into this new approach. One of the other ways I want to explain this is that we're trying to move away from domestic violence destructive practice and policy. And domestic violence, we create a continuum of domestic violence informed practice. You can get it on our website as well. We define domestic violence destructive as one end of a continuum, and that is systems behaviors that either push survivors, adult and child survivors, away from services and or put them in greater danger. And so the classic example of that sort of paradigm or that case practice is asking a domestic violence survivor to agree that she will not expose the kids to any more violence. And I want you to just think about that one for a second. Asking a crime victim to guarantee there'll be no more crime perpetrated against her and her children, and then saying if this happens again, then you may be greater engaged with the child welfare. We may even remove your kids from you because somebody else made a choice to get violent. Now, this is very different than a collaborative safety plan that's developed with her to try to sort out what, in her current situation, with the perpetrator's pattern of behavior as it is, she has control over to do, for instance, if he violates her order of protection. And that's very different than a plan where it says if father violates an order of protection and comes over to the home, these are the 3 steps that we've decided you'll be able to do reasonably based on his prior history and your current situation. That's very different than a plan that says she will guarantee the kids won't be exposed to more violence. That latter plan, which we refer to as domestic violence destructive, often will mean somebody doesn't want to call for help, doesn't want to call the police, and there you begin to see both the increase in risk and the pushing away from services. So we want to move away from that approach in a different direction, and we want to really rest on these two principles, these two strategies that were really identified in the Greenbook, which is, we want to measure our actions or be guided by, are we improving the adult survivor's safety? And I would add to that the children's safety as well. And then, are we removing the risk created by the perpetrator? And there was always these two streams in the Greenbook work. And I think in many ways people would agree that the perpetrator stream wasn't as well developed as the focus on adult survivor safety, even though they can't be separated. And that really, that we also wanted to make sure we're really speaking around the voices of kids and the experiences of kids in all this. Because while those are in alignment with adult survivor, they're not always in exact alignment. And so this was really identified in the Greenbook in terms of what they wanted, what they wanted to see happen, what was guiding the Greenbook. And these things are present in the Safe and Together work and the approach that we're going to be talking about over the course of this webinar. So I'm just going to stop for a second and answer a couple of questions before I leap into the next portion of the presentation. Stephen Zolman asked how many county councils have adopted the approach to reduce filings for failure to protect. And, it's really hard, Stephen, to collect data. What I can tell you is out of Florida, we've been doing work with DCF in Florida and the Florida Coalition Against Domestic Violence. Both have been great partners, and I think we often get the most excited when we can work both with child protection and domestic violence advocates in the courts, even in certain places, to get this in place, because when this framework is adopted, you can see a lot of accelerated change when it's adopted by many different parties. And so, for instance, we've trained the co-located advocates in Florida around use of this model. We trained domestic violence liaisons in other parts of the country around using this model, as well as child protection counterboards. For instance, Delaware, their DVLs have been trained. And New Mexico, we're training both child welfare and advocates around the use of this model. So when we talk about the county councils have adopted the approach, what we know is from Florida, for instance, that they saw in 2 different jurisdictions, so 2 different points of time, correlative data, that what they saw was a 50% drop in their domestic violence-related filings in child protection. In one of those areas, where they had data, they didn't see anything to show that there was an increase in repeat maltreatments. What they also saw in one of those jurisdictions was increased identification of domestic violence, which is, to me, the kind of trio of things you want to see: better identification of domestic violence, less filings, which means you feel more comfortable working to keep the kids safe in the home, and no evidence of repeat maltreatments. Now, this is all correlative data, but a 50% drop is significant, and again, the caveats depends on your baseline. It depends on your ability to measure this. Domestic violence often intersects with other case factors like mental health or substance abuse. What I would say is one of the biggest barriers to measuring that kind of change in systems is that most of the child protection systems in the country don't have a domestic violence specific maltreatment that makes it easier for them to use their data system to measure change as a result of this work. So we're often trying to move forward in ways that are hard to measure at that larger systems change level. Florida has, it used to be family violence threatens child as a maltreatment, and that's changed a little bit. I think the naming of that's changed a little bit. And so what we're seeing is that attorneys love the model because it's fact-based, it's behaviorally focused. It moves us away from suppositions, conclusions, to more fact-based practice on the part of the social workers, and that's really important. That flows through the courts, and so we've seen a lot of help. And remember, the other part of what I'm going to say is that we kind of start talking about perpetrator pattern-based approach. We're not taking failure to protect away. without replacing it with something else. We're framing the safety and risk concerns for kids around the perpetrator's pattern of behavior. And then we're tying it to a better assessment of survivors' protective efforts. So I really want you to understand that the model really has multiple moving pieces to it. And you know, it has a lot of power because of those multiple moving pieces. And as Ellie Breitmeyer kind of puts on there, not only I mentioned some places they're using Safer Together, there are a lot of places in the country like Vermont that have been using it, and their domestic violence specialists are coaching their child protection frontline worker peers and using them all in their work. So we have a lot of great collaborations all over the country. And if anybody who's using Safer Together wants to post about it in the chat box to describe it, kind of following Ellie's lead, you know, that might be nice for people because that may create some cross discussion about it. So if there's anybody on the call who's using the Safer Together model actively in their work and you want to put it in the chat box and briefly describe what you're doing, feel free to do that. Yes, and going to Arati Vasan's comment, this is endemic of domestic violence. Generally, survivors are held to a higher standard of behavior and an inaccurate agency framework. And the Safer Together model is really meant to actually address, I'll talk about some of the gender double standards that really kind of feed into that higher standard of behavior. And this is really important, again, for family court decisions, you know, custody and access decisions, and also child protection decisions. So thanks for the questions, and please keep posting them in the chat box. I mean, it's just, I love responding and reacting to them, so that would be good. So the article that we put together is talked about this need for a paradigm shift away from this failure to protect approach to what we describe as a perpetrator pattern-based approach. And in the most basic way that you can think about this approach, and in some ways it's really simple. If I picked up a case file, or if I picked out a neglect filing, or I picked up termination of parental rights, or I picked up a family court brief around custody and access, or an evaluation, and we were looking for issues around domestic violence and its impact on children to make better decisions about safety and risk in the child protection arena, or we're looking at the family court arena, custody and access, and we wanted to make good decisions. And so for decision makers, really to think about this is sort of, you know, how is this fitting into your role as if you're sitting on the bench or you're focused on child protection decisions. If I picked up your case file or your documentation, would I be able to see clearly the specifics of the perpetrator's pattern of coercive control and the actions that perpetrator has taken to create harm for the children? And what that really means is no jargon, descriptions of specific behaviors. It's not just he has a history of domestic violence, not that he has a history of arrest for domestic violence. It's really very specific, which is describing the behaviors. He physically assaulted mom in these ways, this many times. He's used the kids against her. He took the kids out of the house and threatened to not give them back to her unless she gave him money for drugs. You know, that he has installed an app on her phone to check up on who she's talking with. He expects her to give all the receipts over to him when she goes shopping, and when she doesn't do that or doesn't like the way that she spent the money, this is how he responds in terms of yelling and screaming. These are the specific things he calls her. He chooses to do this in front of the children. And I'm just giving you a feel for the levels of specificity we're talking about related to the behaviors. And that when we think about this, that I want you to be thinking about, you know, and I remember a judge out west that I talked to, and after talking about 20 minutes around this issue, he said, oh my God, I don't get enough information to make good decisions. Because all he was getting was family has a history of violence, couple has a history of violence. And it's those kind of things that when that's what is being presented to a judge or to a supervisor or to a manager, or that's all being that's being presented at a team meeting that really I want you to be thinking about, I don't have enough information to make determinations around safety and risk related to kids. I may not have enough information to make good custody and access decisions. And that I need more information about the perpetrator's pattern of behavior and what those things are. Okay, so a perpetrator pattern-based approach is focused on the perpetrator's behavior. And I want to make the distinction. That's different than saying he's isolated the survivor, because actually what you want to talk about is how did he isolate the survivor from friends and family. And so it's the how that's often the case, that when you talk about the behavioral part of the model, that's one thing. And then also you want to use a coercive control lens, not just arrests, not just physical violence, but you want to use that full framework, and if people are familiar with the work of Evan Stark, the full framework that's associated with behaviors that limit other people's choices. And it doesn't always have to involve physical violence. In fact, we know that severe cases of coercive control that don't involve physical violence can sometimes lead to death and end in a murder. And so when we talk about these things, we want to use that coercive control framework, not just the physical violence framework. And I'm going to make some assumptions that people are familiar with the different forms of non-physical control and abuse, for just the sake of moving ahead right now. Another piece that defines a perpetrator pattern-based approach is that it really looks at actions the perpetrator's taken to harm the kids. And so when we get to this later and we talk about multiple pathways to harm, I just want you to be aware of, we're including into this idea that the domestic violence perpetrator, intimate partner violence, and child abuse and neglect are often tied together to the behaviors of the domestic violence perpetrator. They're undermining the other person's parenting. They're interfering with that relationship of the other parent and the children. They're neglecting the kids directly. They're abusing the kids directly. They're using kids as weapons against the other person. And that our assessments of child safety and risk have to not just look at what's happening between the adults in a siloed way. It really needs to tie together the perpetrator's behavior and their parenting role. And what that means is that we need to start seeing perpetration as a parenting choice. Domestic violence perpetration is a parenting choice. And what we want to do by saying it that way is to really help people think about this idea of when perpetrators, domestic violence perpetrators, are acting, quote unquote, towards their partner, that at this point in time, based on the knowledge we have of the way domestic violence behaviors harm kids, the way it impacts child and family functioning, that we cannot separate out the behavior of perpetrators to their partner with our assessment of domestic violence perpetrators as parents. I can't say that too strongly, because what we've often done is said, that person, yes, they horribly abuse their partner, but they're a good parent. And what we know from the literature, we know from clinical practice, is domestic violence perpetration impacts child and family functioning, not just when the kids see the violence, but through a broad swath of child and family functioning that gets impacted through multiple pathways to harm. So I'm going to come around to that, more through the presentation. So a perpetrator pattern-based approach keeps the experience of the adult and child survivor at the center. Do not be fooled by the language of a perpetrator pattern-based approach. The center of the measure of efficacy, of change, of success with this model has to do with our outcomes getting better for the adult and child survivors. So that, to me, is the primary measure about whether we're shifting our systems in the right direction. Are survivors safer? Do they have more self-determination? Do they have more quality of life and better satisfaction? Is their well-being improved? So every bit of this is measured by that, from that perspective. It's more than a perpetrator engagement model. A lot of times people will say to me, well, so what you're saying is we should do more to engage perpetrators. And I go, perpetrator interventions, including engagement, is one piece of the approach, but you can actually apply this without ever engaging the perpetrator. Survivors, advocates for survivors are using this model all over the country and all over the world to change the way they're doing advocacy with child welfare involved clients, how they're talking to clients who may not be involved with child welfare about the perpetrator. Brief story. When we look at, we're doing some work with advocates in the U.S., and they were training their colleagues. They were supporting their colleagues in applying the Safe and Together model in their work, and they were running a support group for moms who are involved with child welfare. And so what ended up happening was that, as many of you who are familiar with, those kind of groups are often very difficult. They're painful. Survivors feel very angry. They feel guilty. They feel it's unfair that somebody else made a choice to be violent, and they're being forced to engage the child welfare system. And so what this one experience in the group was, they went around the group and they said, "Why are you here?" This was the first night of the group, and "Why are you here?" And all the women were expressing all the things I just talked about: anger, guilt, shame, upset about being there, being involved with the child welfare system, what was happening to their kids, what was happening to them. And then, because the person had some exposure, the facilitator had some exposure to Safe and Together, she said, "Well, we're going to go around again, and we're going to talk about how your partner, who's the domestic violence perpetrator, is parenting. What kind of parent are they? And how does their behavior towards you fit in with the definition of a good parent?" Those kind of things. And what was reported back to me, I wasn't there, reported back to me through the colleague I was working with, is that the aspect in the room changed completely. That the women in the room became more upbeat, more engaged, more optimistic, because the facilitator was articulating that their partners was making choices through their violence and their other behaviors that were evidence of bad parenting. And they were bringing that idea and concept into the room with the survivors. And what it was doing is reducing the guilt and the shame and allowing them some room to connect to the group, to each other, in a way that was more constructive. We've seen this repeated over and over again, in a court setting or a legal setting, meetings with child welfare and child protection workers trained in this, supervisors and workers trained in this model, sitting down with survivors and their lawyers and starting the conversation by saying, "We want you to be really clear that our concern here is for your partner's behavior and the danger it's representing to the kids. So I want you, again, from a practice point of view, think about this. Where in your system is child welfare specifically saying that when domestic violence is an issue in families, that they are proactively articulating to survivors that it's the perpetrator's choices and behaviors that are the child welfare concern related to domestic violence, not the survivor's choices and behaviors? Because if domestic violence is an issue, it's driven exclusively by the perpetrator's willingness to use violence and the choice to use violence and control. And then when you add on to this, people's ability to tell survivors what they're doing right in terms of protecting their kids, what you hear back, what we've heard back is that the survivors' shoulders go down in those meetings, that they get more relaxed, that the attorney gets more relaxed, that what could be a very adversarial meeting becomes a much more collaborative meeting, which is better for the survivor and better for the kids and better for the child welfare worker. And so when we talk about moving to a perpetrator pattern-based approach, that we want you to see and think about all these different aspects that might come along with it, including that case presentations, supervisory meetings around domestic violence and families starts with a description of the perpetrator's pattern, not the survivor's decision-making. Instead of starting with a case presentation with, "Well, I've got this case with this mother who's been in multiple abusive relationships, or she keeps going back to this guy," which is often the way these cases are presented. "I've got this case with a father or the stepfather or mom's boyfriend is engaged in these specific abusive and violent behaviors, and this has been the impact of those behaviors on child and family functioning." If you walk away from this call with committing to that one change, moving your case presentations away from starting with talking about mom's decision-making and moving towards talking about the perpetrator's decision-making and their impact on child and family functioning, you will have taken a huge step forward towards more domestic violence-informed practice. And that can be done automatically right away. And, if anybody wants to try it and write me afterwards to tell you about the difference, we've seen this used over and over again as a way to shift practice. Remember, if you're presenting a case to me and I haven't read the record or met with the family, which is often the case of, lawyers and guardians and other people, then what happens is they're seeing the family through the eyes of your presentation, your documentation. If the documentation starts in a failure to protect, victim-blaming way, the outcome is likely to be different than if it's going to be presented in a perpetrator pattern-based approach. And one of the things, the last bullet on this slide, is that over the years of work, I've come to the conclusion that child protection agencies, county and state child protection, have a huge role to play in the leadership around the move to this kind of practice. That this practice really can't get embedded without the leadership of statutory child protection at the county and state level. There's no way it can move forward without them because they play such a critical role in defining what the child welfare issues are, how they're understood. They are the ones who present the case to courts, to magistrates, and to judges. They're the ones who set the tempo of the community's response through service contracts, through their collaborative meetings. So child welfare, for instance, sits in child advocacy centers, where you often have the intersection of domestic violence and severe child abuse or child sexual abuse. That child protection sets the tenor of the work through the ways they approach court cases, through the way they ask for their evaluations, through their setting of expectations through treatment plans. And so when you think about this, how would you shift the practice in our communities? I'm a huge fan of child protection. I think child protection agencies are one of the most underappreciated, hardest jobs out there. They're on the sharp edge of the decision-making and the sort of, we've invested in them, the societal expectation of the last line of defense for kids. And the work there is so hard. And so I've become, over the last 20 years, a firm fan of child protection's capacity and need to be a leader in this area to move us towards domestic violence-informed practice. And what I can say is in most communities we're working, when child protection steps up and says we want to do this way, their partners are, particularly domestic violence advocates, are thrilled about the movement in this direction. So just to know that's often what we're seeing in this work. So I'm going to stop again and take a few questions. Joan has another question. Courts seem to think it's often mutual DV. How do you deal with this? And how often do you think it's clear-cut the tone the party is the perp and one party is the victim? So, Joan, this is my experience and perspective from dealing with hundreds of cases. I have both a practice tip and then an observation. The practice tip, the model cut its teeth in Connecticut. I worked for 17 years with a child protection agency here as a consultant, and at the same time was doing a lot of work nationally and then internationally, and so had a lot of experience with a system that at one point had a 15% dual arrest rate, and I think the national average at that point was 2 or 3% or maybe 4% dual arrest rate. And so I got presented with a tremendous number of cases where it was presented to me that both mom and dad are violent. And so I really got a lot of practice in helping people sort out primary aggressor and sort of what's going on here in the family. And so the very basic practice tip is if you came to me and said, it's mutual DV, this is what I would say to you. Tell me about each person's pattern of coercive control and actions taken to harm the kids. I wouldn't ask you to tell me about the relationship dynamic. I wouldn't ask you to tell me for you to tell me about the last incident of violence. And remember, actually, so patterns of behavior go far beyond the current incident. They go far beyond physical violence. And that when we ask that question, and so I'm actually asking for facts. Tell me about each person's pattern of coercive control and actions taken to harm the kids from whatever source of information you have, interviews, police reports, child protection records, medical records, and not only am I looking at their behavior to their partner, I'm looking at their behavior to their kids, and I'm looking at their behavior across relationships, because we would never ignore in child sexual abuses somebody's prior history of child sexual abuse. That would be absurd. The fact that we approach domestic violence from a relationship-based assessment lens instead of a pattern-based assessment lens is to me just beyond comprehension at this point. We choose to ignore information we have at our fingertips. This is not information we need to go and get that's new. We just need a better way to put it together. And so we want to ask about this person's behavior in prior relationships. We want to ask about whether they've ever been engaged in abuse or violence to their kids or kids in another relationship. And so when we see this, when we apply that approach to these dual arrest or mutual DV cases, what I have to say is, having applied it in multiple cases over and over again across multiple jurisdictions, we find that most, but not all of these cases, look like what we think they're going to look like, which is in a heterosexual relationship where the male domestic violence perpetrator is engaging in a tremendous amount of coercive control actions and creating much more harm in the family. And if there is violence, it's defensive on the part of the survivor. Now, that said, that same approach will help you identify when that's not true. I want people to really hear that. We understand that both men and women can be violent, both men and women can be controlling. So while we have a gender-responsive analysis and we understand a lot of the dynamics around gender and coercive control, that when you practice it in this way, that really gives people the facts to say, oh, in this particular case, which is less common, the survivor, the woman in a heterosexual relationship is the primary aggressor based on behaviors. Same thing is true for same-sex relationships. So by asking that question, tell me about each person's pattern of coercive control and actions taken to harm the kids that you really can do a better job. But it has to be based on this pattern-based thinking that's expansive, that's much more similar to the approaches that we take for granted in sexual abuse cases, child abuse cases. We have child abuse registries because we feel like it's important for people to understand when somebody has been implicated or alleged or found to be abusive to kids in one setting, that they might be a danger to kids in other settings. This pattern-based thinking is very familiar to us. It just hasn't been applied systematically to domestic violence cases. And so this fog around mutual DV often lifts really clearly when this model is applied. And again, it is not, so from a legal or fact-based point of view, or from an evaluation point of view, when applied in that way, you're not prejudging based on gender. You're not prejudging based on anything. You're actually asking a fact-based exploration, but using a very specific framework: coercive control, history across relationships, violence that may be in public setting as well that may contribute to the coercive control, privilege and intersectional issues that may give power. All these different things get factored into it, including the use of kids as weapons, including the undermining of the person's parenting, and that you use that in a pattern-based lens, not in an incident-focused lens. And what I can tell you is very quickly that oftentimes it helps really make sense of the survivor's behaviors, because the more we see the domestic violence perpetrator's pattern, the more we begin to put survivors' decisions in a clearer context. Okay. So another question was, is the approach different when the perpetrator is not a parent but a step-parent? Mostly not. And what that means is the foundation of identifying the patterns of behavior stay the same, regardless if it's an unrelated caregiver, if it's a biological parent, if it's a legal guardian, if it's a foster parent. Their legal status at the beginning of it doesn't matter, in the sense of understanding what's going on in the home and who's responsible for what choices, getting a context, understanding how the perpetrator may be interfering with somebody's recovery. So, for instance, understanding that a boyfriend who's unrelated to the kids is sabotaging mom's recovery and getting her kids back, that understanding, that assessment, doesn't require us to care about whether he's a biological parent or legal guardian or not. We want to understand the barriers to her completing her treatment. And one barrier may be that he is interfering with her ability to go to those programs. What we do next then may depend on his legal status with the court. So I want to make that differentiation. So the foundation of the practice doesn't really matter. Okay. Thank you for these questions. I'm going to keep going with the presentation at this point. We have about 30 minutes left. And so barriers to the shift, policy and practice gaps. For instance, a lot of states haven't had domestic violence specific policies in child protection. They often don't have specific training or enough training on domestic violence. To be honest, if you think about 2/3 of domestic violence, 2/3 of deaths of children known to child welfare are domestic violence related, correlate with it, and that it could be present. We get informal estimates from our child protection partners all over the world saying they think domestic violence is present in a meaningful way in up to 80% of their cases. Then you begin to realize that if you're spending 1 day of training on domestic violence in a new worker training, you're probably not giving your workers enough training. Our foundational domestic violence training for child protection workers is 4 days. That's just the foundational one, and that doesn't mean training for supervisors or coaches or anybody else. So there's often these policy and practice gaps. Gender double standards, which is a huge area, and I'll kind of come back around to it a little bit, but somebody mentioned in the chat box, which is having low standards for men as parents, high standards for women as parents, as evidenced by, in our practice, in the way we ask questions, asking mothers if the children are medically up to date versus asking fathers regularly, expecting mom to get the kids to doctor's appointments or to mental health appointments, expecting mothers to keep the kids clean and the house clean, or keep the kids on medication. Or right now, for instance, with people doing a lot of homeschooling or guiding schools, kids schooling from remotely, that in many instances we assume the lion's share of what's happening around that is mothers are doing more work now. And so what we see as a gender bias in practice is that people focusing on expectations around mothers more than fathers. So you have case plans where the father's case plan may not mention keeping the kids clean and keeping them medically up to date, but it may be mentioned on moms. Another barrier is intersectional issues where class, race, access to resources becomes barriers to actually understanding survivors' efforts to keep their kids safe or what are good interventions with perpetrators. And so you'll see in a minute that what we try to do to address this is really, for instance, identify protective efforts that don't involve engaging formal systems, because if you're part of a group of people who've experienced colonization, systematic racism, other forms of discrimination, if you come from a country where you don't trust the authorities, then you may be judged poorly by child protection systems who look to measure survivors' efforts by, did she call the police? Did she get an order of protection? So that's just one taste of the intersectional issues that are really barriers to the shift. Another barrier to shift is the siloed approach to mental health, domestic violence, and substance abuse. And we have whole online courses. We've got a course on intersections on our virtual academy. But just for the argument's sake, the siloing of these systems, the mental health, substance abuse, and domestic violence systems, has really made it easier for us not to hold perpetrators accountable as parents, and that also that we're really not intervening with survivors in the way that we should. Because, for instance, if you've got a mother who's a domestic violence survivor who's also a substance abuser, and you're not assessing how the perpetrator might interfere with her recovery efforts, then you're setting her up more likely to fail, for instance. And so a really basic bit of domestic violence informed practice is that is to really is begin to assess how the perpetrator may interfere with the recovery efforts of adult and child survivors around mental health issues, around substance issues, around behavioral health issues. The last big barrier to shift that we've identified is worker safety. If worker safety needs are not addressed, it's really hard to get them to practice better in the space because they have big concerns around domestic violence. Safety, whether it's the safety of the family members, am I going to make things worse for mom by talking to him? I'm scared to work with him. I don't feel safe. I don't feel comfortable. And so we really started stepping up our work on worker safety. In fact, we have on our website a white paper related to worker safety about how to make improvements in worker safety related to domestic violence on cases. So I would encourage you to kind of browse our website after today's training, safeandtogetherinstitute.com, and really look for some of this material that's up there, including YouTube videos that kind of cover a lot of this. So, you know, coming out of this idea of a perpetrator pattern-based approach and also concerns for worker safety, over the last 20 years, the importance of the idea that fathers' choices matter to child and family functioning has become more and more of a centerpiece of our work, or an underpinning to our work. And I really want to start with an important distinction, which is that this is different. This is very different than saying fathers matter to kids. On one level, that's obviously true. But the problem with that approach where fathers matters to kids is often that conversation has been missing any kind of qualitative assessment of the quality of the fathering and its implications for child and family functioning. And we know that the system has done tremendous disservice to poor men, men of color, men with history of incarcerations, and that through racism and economic oppression, that those men have been marginalized by systems that are responding to families. And that's a problem we need to work to correct. We also need to work to correct the gap in education that most people can go to school for human services, for social work, and never get a course on male parental development. And in their internships and field placements, they don't even have very few of them have the experience of engaging and learning how to work with men, except in very specialized populations like juvenile justice, adult corrections, vets, homelessness. And so what we find when we go into communities, that up to 90% of people sitting in any given room listening to a presentation on Safe It Together have had no formal educational experience around working with men. I'm not talking about domestic violence perpetrators, working with men, around being a father, around employment issues, around mental health issues, and that so very few of them, less than 10%, have that formal educational experience or even internship or field placement, which means you can safely say in the general population of your child-serving service providers and statutory service professionals that upwards of 90% of them have had no formal training about working with nonviolent men. And so what that means is people are bringing their undigested attitudes, beliefs about men, around parenting, some founded, some unfounded, that people are all over the place, and they're often relying on their personal experiences, undigested, when they look at families as the lens by which they look at families through. And so part of what we've been saying to people is if you want to become domestic violence informed, you really need to start thinking about how do you practice with all your families in this way, that fathers, male caregivers, fathers, you know, whether you're talking about stepfathers, foster fathers, male caregivers, uncles, grandfathers, trans fathers, really we're not making a distinction here, that their choices and behaviors matter to child and family functioning. So I really want to state this in a very specific way. It's a behavioral focus. It's a behavioral discussion around the role of men in families. And what I'm going to suggest to you is that we're missing lots of different ways that men are helping families function better. We're missing the strengths they bring to families, behaviorally what they're doing to help when a partner has substance use, how they're helping keep their kids focused on their academics, what they're doing in terms of their behaviors that keep the family functioning better. So one of the simplest questions you can ask is, how does the male caregiver, whether he's in the home or not, how does the male caregiver, whether he's in the home or not, because that doesn't matter, how does his choices and behaviors make the family functioning weaker or stronger? So again, one of these things to be talking about this is just this, getting this framework, because what I'm going to say is that one of the barriers to actually doing good work around domestic violence perpetrators who are fathers is our lack of capacity in our communities, in our agencies, in our systems, for social workers to have the confidence and skills, a practitioner of the confidence and skills around working with men in general, and them lacking a map, an operational map that when they go and assess families, until somebody says something different to me, if you say, oh, I assessed this family, what I'm going to assume is what you did was assess mom and the kids and their functioning. And that if you engage the father, it may be in a limited way. If you have looked at the father's role, it may be very limited. You may say he's not in the home, he doesn't live in the home. So all these different things are barriers to this really applying the model. And so when we talk about father's choice and behaviors matter, it's a framework that is wider than just domestic violence cases, but it's a foundation for really using this perpetrator pattern-based approach. And so when we go in and train and we get people to think about it, we give these examples about how, you can start talking to family members about this. So this is about how we practice with one another, and this is about how we talk to families. And so you see some questions here that are really about talking to men about their behavior, their functioning, and what their functioning means for the rest of the family. So you begin to see sort of how these things begin to tie together, including what do you do to support your partner's relationship with their friends and family. And so these are kind of questions that asked in every family may help us uncover domestic violence. Because if you ask these questions instead of asking or alongside of, do you ever get hit or do you ever hit your partner, these questions may be a doorway to people feeling comfortable to disclose and be in the sense of whether this is happening or not. And so you see the parallel questions or ways we can talk to moms. Describe how on an average day your partner helps you keep family routines running smoothly. One of the things that we hear from survivors around their partner as a parent is that they don't feel like they can leave their kids with him because they feel like when they come back things will be worse. And that might not be the kids were hit, but that he's agitated them, he's upset them, she's got to calm them down. That's often we hear from survivors about visits over weekends. And so part of this is really understanding that we're widening our lens out to coercive control. We're widening our lens out to think about how domestic violence perpetrators, through their behavior, undercut child and family functioning. And we really, we bring that alive in our practice. And to me, that's the most important thing. We don't have a ton of time to get into this, but it's in the article that is in the Greenbook 20th anniversary journal by the National Council of Juvenile and Family Court Judges. So, reach out to the council about that, how to get that. You can purchase that from them. One of the things that we're starting to train people in, we have an online course called Working with Men as Parents that goes through this more in depth, but really describes how you begin to use a male parental development framework, which is more dynamic. It's more about the lifespan to develop prevention and intervention strategies with fathers in general, but also includes domestic violence perpetrators and scripts and language to talk to them. But begin to give you a picture of, where are you in your systems talking to men about their experiences with becoming a dad, including becoming pregnant, and the birth of their child. And just, again, so, are we talking to men through an old lens of, do you have a job? Are you doing drugs? Are you avoiding incarceration? A lot of times our things are, this issue around this issue around sort of, are men breadwinners still, is often very much shaping the way we talk about men and not getting into more of the family functioning model. I will get, Anita, thank you for the reminder about multiple violent relationships, and we'll get to that. when all this kind of approach comes together in the Safe and Together model, it comes together in these practice principles that we want to work with that non-offending parent, the domestic violence survivor, around child safety, the children healing from trauma, stability, and nurturance. And so remember that we're keeping a child-centered lens. So this is a domestic violence model that's designed for child-serving systems, including family courts. I can't stress that too much, and I appreciate Joan raising that and asking me to speak to that. But this approach can really help magistrates and judges, parenting time evaluators, guardians, in their assessment of families, particularly around custody and access and around risk and safety, because it gives you a concrete behavior and behavioral approach to kind of look at it, tying it back to domains that are critical for kids: safety, healing from the trauma of violence, stability, and nurturance. The second principle is, are we looking at our ability to partner with a child, the non-offending parent, from a child-centered point of view in terms of efficiency and effectiveness. And the simplest way to say it is do we go in assuming that the survivor was engaging in protective efforts before we ever showed up? When we coach workers around using this model, we say, tell us about what you learned about her protective efforts, and don't just focus in on did she call the police, but talk to us about day-to-day efforts. Because if we can identify those efforts that are active, even if he's still interfering with them, then we have a better chance of partnering with her. We have a whole 6-step process of partnering, and this is getting all put into online courses. So, we've got a new course coming out within the next couple of months on partnering with domestic violence survivors. And so we really detail that 6-step process. But it's efficient, because if you don't partner and you start with a survivor by saying, well, we're here because you and your husband got into a fight, we've just made our work harder than instead of saying to them, we're here because we got a call that your husband got arrested for assaulting you and choosing to do that in front of your kids. And so we're out here to really check on your safety, the safety of the kids, and we want to make sure that we can help you as much as possible. And so just that small change in language really opens the door to partnering, which makes our job easier and makes us more likely to be effective with her. The third practice principle is how are we intervening with perpetrators to reduce risk and harm to kids. And you'll notice accountability from the second line, and that doesn't mean that we don't want to hold perpetrators accountable for the harm that they've created, but it is a recognition that in systems that are racist, that have been classist, that often accountability language has been equivalent of, has he been arrested, has he gone to jail, and those kind of interventions, has an order been served against him, which are really important options for families, but we have to remember the ultimate goal is safety and improved functioning of families for kids. And so we have to think about engagement, how we use the courts, different strategies, because we want to ask the question, what do we do to intervene with the perpetrator to reduce risk and harm to kids? And I won't be able to, kind of do full justice. We do one-day overviews of the model. We have our virtual core online, which is a 4-day training now online. We do extensive training for supervisors using all these bits and pieces. But these 5, I ran a domestic violence consultation initiative inside child welfare for years. We use this model in thousands of case consultations. And what I'd ask my consultants to fill out is a form where they filled in the boxes of these 5 things. And the idea is, if you can't describe the perpetrator's pattern of coerced control, actions they've taken to harm the kids, that full spectrum, not just the formal use of services, but the full spectrum of the non-offending parent's efforts to promote child and safety and well-being, then you're really going to be missing lots of things. If you can't describe how the perpetrator's behaviors impacted child and family functioning, then you're going to be missing telling the story about what the perpetrator's behaviors means for the children. It's not just that they witness. If you really think about that language, the children witness domestic violence. The perpetrator is invisible. So the model puts the perpetrator back into the picture and then asks the practitioner to tell the story. How did those behaviors adversely impact the kids? Not just that they saw it, but what did they say in response? How did they act in response? How did it change their daily routine? And then how does this all intersect with race, class, substance use, mental health issues? None of those things are causal, but they're often very important to the families, to the family situation, their context. And so if somebody doesn't want to get divorced, then we, that's part of the leverage that the perpetrator may have against somebody, that divorce is not approved of in their culture. It's important for us to know these things, for instance. So again, I won't be able to go into detail about that, but if you're interested, we have more material on our website around this. And so going back to Anita's question, just a reminder, visit multiple relationships and trauma-informed work, of course, that if you came to me, and this is, Anita, if your question, if I'm kind of going to scroll back and see if I can pick it up again, but if you came to me and said, I've got a survivor who's been in multiple abusive relationships, what I would say to you is, okay, one is, let's not lose sight of that each of their individual partners made their own choice to be violent. That's the first thing. That people being victims in multiple situations doesn't make them culpable for the perpetrator in each of those situations' choices to get violent. Lots of people are in relationship with trauma survivors and they don't abuse them. And even if she's been in multiple abusive relationships, if we want to be trauma-informed, we want to understand how being victimized in one situation may create vulnerabilities that somebody else chooses to exploit in the next situation. Again, a perpetrator pattern-based approach really gives us the language and the framework to keep a focus on child safety and risk, but to understand that it's the perpetrator's choices and behaviors, even if the victim has a trauma history, that person makes choices to be violent. The perpetrator, the survivor, is not responsible. And in fact, I think what we've seen is, while the move to trauma-informed practice is really useful and has so much value, that what the danger is that some ill-purposed trauma-informed language or trauma-related language can become another form of victim blaming. We can't expect much from her because she's been in multiple traumatic relationships. We can't expect, her to protect the kids. And just because somebody's a trauma survivor, and we have a research briefing on this, by the way, just because somebody's a trauma survivor or even has mental health or substance issues doesn't mean they can't actively protect their kids and they're not good parents. You cannot make that assumption. And so anybody out there who's hearing people say that well, she's been in multiple abusive relationships. One is, have we assessed the strengths she's developed in leaving those relationships? So somebody's been in a prior abusive relationship. They've learned strategies and things that they've done to keep themselves safe. Are we including that in our assessment of their strength, or are we just summarily dismissing them as somebody who is a repeat victim? Second is our system as good at identifying serial abusers as we are identifying serial victims? I think one of the things that's most common is that systems are so focused on mothers in many ways, and they were developed around intervening with mothers versus fathers, that our thinking is still focused on serial victims, mothers who have trauma histories, and we're much less focused on thinking about serial abusers and patterns of abuse across relationships. And again, we're better at this with sex abuse cases. We're better at this with severe child abuse cases. We are not good at it when it's related to domestic violence in kids. And so Anita, I hope that helped you. And so the last thing I'll kind of share with you here is when we're talking about really telling the story around the perpetrator's pattern of behavior, that we have to move past just did the kids see it or hear it, which is that children's trauma and safety bit. And we have to really be able to tell the story about how the perpetrator's behavior has caused a loss of income, loss of housing, has caused the family to lose contact with extended family, and educational disruptions. We want to be able to tell the story about how the perpetrator's behavior has impacted the partner's parenting. When we see kids not listening to a mother who's a domestic violence survivor, how that may be the result of the perpetrator's undercutting her authority. These are all the ways we lose focus on holding perpetrators accountable. And this kind of stuff starts in the way we talk to each other, we document cases, how we write it down, how we produce our petitions. And so when we look at these families, going back to the beginning, you want to be moving away from this family has a history of domestic violence. to this multiple pathways to harm, perpetrator pattern-based approach that really kind of keeps in focus how the perpetrators acted and what it's meant for child and family functioning. So it shouldn't just be about the kids see it or hear it. It's about the perpetrator's behavior, and list what they were, has caused the family to move 3 times in the last 2 years. Because of those forced moves, the kids have lost time educationally, have lost contact with extended family, and they are living in an environment where they've lost support from the medical professionals. We have a kid who's not doing well in counseling and there's a history of domestic violence. Are you tying together, exploring, did the domestic violence perpetrator contribute to the kid not showing up to counseling appointments, or do we just assume the mother didn't get them there? And so when we look at these things, you know, when we look at survivor, who, you know, are we willing to break down the silos and really look at things like he caused her substance use. Before the meeting, he shouldn't have anxiety or depression or trouble with alcohol or drugs. Or do we look at somebody who is in recovery and then a partner starts getting abusive, and did that problem return and get exacerbated? Do we look at that situation and go, here we have somebody who's interfered with mom getting counseling, interfered with the kids getting counseling. So if we're working in systems where we expect mothers to make sure that things are happening with the kids, then we often have to really work much harder to account for how fathers, domestic violence perpetrators' behaviors are actually interfering with those goals and objectives being met for those kids. So this is, you know, the shift that we've been trying to build on from where the Greenbook started, and hopefully you get a feel for the power of this, its global implications, and its effect everywhere. If people want to reach out to us, here's our contact information, safeandtogetherinstitute.com. We've produced, I didn't even talk about this, the first time in a while I haven't talked about COVID-19. We've produced a lot of COVID-19 specific material. Our Friends and Family Guide is a lot of material on our site is free. And our virtual academy, which is academy.safeandtogetherinstitute.com, has a mixture of free and for charged courses. Our virtual core is online for the first time there. So I encourage you to go to academy.safeandtogetherinstitute.com if you want to check out those resources. Also, there's a podcast called Partnered with a Survivor that you want to check out on, again, for free on Apple platform, on Google Podcasts, on Spotify. And so all these things, this is myself and my partner who's a domestic violence survivor and a child abuse and neglect survivor, talking about her experience and just practice in the field. And so Partnered with a Survivor is another free resource for you. So to wrap up, I hope I did justice to the spirit of the Greenbook and the tremendous amount of work that's been done. To wrap up, I want to thank the National Council for Juvenile and Family Court Judges for having me on this, and for the long collaboration I've had with them in multiple settings in multiple ways. And I hope that if people have questions and follow-up, they can reach out to me at David Mandel at safeandtogetherinstitute.com, and I'll be happy to respond to emails that you send to me. So, Amber, I think that's it, unless there's something else I should be doing at this point.
No, I think that's it.
All right. Thank you all. Stay safe, wash your hands, and be well.